Brains Hospital is creating an awareness about the prevention of the brain injuries and the spine injuries. The March 20th is the Head Injury Awareness Day. One of the important problems in the brain injury is spinal cord injury. Nearly 12% of the severe brain injuries will always be associated with the spinal cord injury. The most important thing to remember is that spinal cord injury is something which is not seen outside till it is detected by an X-ray. If the patient is conscious, he might complain of a neck pain or a back pain, and he may have a difficulty in moving the hand or leg. That should alarm everyone that you might have a spinal cord injury. Now, whenever there is a spinal cord injury, most often associated with the high-speed injuries, initially they are all fine. There will be a fracture in the spine, may be causing pain or may not be, but if this person is shifted unassisted, that bone injury is going to get dislocated during the transportation and will result in complete spinal cord injury, leading to permanent paralysis. This is what happens most of the times in our country. Nearly 60% of the spinal cord injuries, they are fine at the scene of the accident, and by the time they reach the hospital, they are paralyzed. Now, the reasons for this is, one, people are not aware that spinal cord would have been injured. Second thing, they, in the anxiety of helping, they will lift the person unassisted. So, improper lifting and bending the spine can break the broken spine already and then make it complete. Third is improper transportation. So every suspected spinal injury person should be transported with a neck support, back support, using the cervical collar or something that holds the neck without any mobility, and a spinal board. And therefore, it's our request that if you find a person on the road with a severe head injury or anyone who complains of back pain or neck pain, do not shift them in and out of just like that. If you want to help, at least 4 people should be there to assist him. One should hold the head, one should support the shoulders with the neck, and one should support the trunk, and 2 people should support the legs. Then you will not allow the spine to move when patient is being transported. It is always necessary that you call for an ambulance, and the ambulance crew should have the proper training as well as the proper equipment such as cervical collar, neck collar, and the spine board, which will certainly prevent spinal cord injury during the transportation. Once spinal cord injury is injured, there is no way we can repair it, and the person is going to be paralyzed for the rest of the life. We can certainly avoid this if we can detect it properly, and till the X-ray is done and the spinal injury is ruled out, he should not be moved indiscriminately.